out today. This is really amazing. I don't have to tell any of you how important this is, how neglected we feel, and how outraged we are. But I'd like to have all of you do an exercise with me. If you could just close your eyes for a second and just think with me about the patients across the country that are terrified right now. Right? The reason that I founded this organization, the reason I've worked with all of you for the last 9 years to build safe access is because there are hundreds of thousands of people in this country who need this medicine. And I spend most of my time on the road, meeting all of you, going to other states. And I have to tell you that the day in the life of a patient is not easy. And you're already struggling with so many other things, whether you have cancer or MS. You're worried about how you're going to pay your rent. You're worried about how you're going to pay for your other medications. You're worried about your family and how they're dealing with your illness. You're taking care of everyone who's taking care of you. And the last thing you want to wonder about is where you're going to find your medicine. Right? It's the last thing that a patient should have to think of. And when I first entered a dispensary here in California, I was already a patient. I had been getting my medicine from dealers in San Diego. I had skater kids meeting me in parking lots to give me my medicine, and it was humiliating. And it affected my health. It affected my ability to work because I would have to stop in the middle of what I was doing to go meet a dealer in a parking lot. Right? It was humiliating and it was disrespectful. And the first time I went into a dispensary was the first time in over a year that I felt dignity and respect. That I felt like someone knew what I was going through and they were willing to break federal laws to help me have that access. So let's hear it for the medical cannabis providers that keep us out of alleys, keep us out of parking lots. Now, this is obviously a hard fight, but look how much we've built. In 2002, when patients came together to form Americans for Safe Access, there were 11 collectives in the United States of America. You guys remember? 11. And they were all operating illegally at the state level, local level, and federal level. And those brave individuals came together and created regulations that got adopted by the state, got adopted by their cities, with the help of patients. And here we are today. There's no way we are going back to the streets. There's no way we're going back to the alleys. Medical cannabis is here to stay. Now, my brothers and sisters, I need you all to know that rallies are amazing. This is how we see each other, right? This is how we remember that we're not alone and that we're doing this together. But rallies are honestly the fun part of what we get to do. The real work we have to do now is to work with our state legislators that are pouring their heart and wanting to help us. That means we have to do our part. It means we have to go meet with our state legislators and help guide them and not just be upset when they don't understand what it is we want. We've got to tell them. So how many people here are going to go home and call their state legislators? Now Obama. So I have a feeling that we're not the only ones saying Obama. But Obama is not the only person in Washington that can help us. And there's actually a bill that was introduced by our allies called 1983 that is a states' rights bill that would actually force the DEA and the Department of Justice out of our states. So after you meet with your state legislator, you're going to go meet with your member of Congress and your senators, and you're going to tell them to support 1983, right? Let me hear you say it. Support 1983. I don't mean big loop earrings. I mean the congressional, the bill in Congress. Thank you all for letting me speak today. And I've been working with many of you for almost a decade. And I just want to say that days like this really give all of us the energy we need to take this home and finish this off. So thank you all so much.